And now to Gabriela Cuevas Barrón, President of the Interparliamentary Union. Gabriela, the floor is yours, please.
Thank you. Thank you very much, Dr. Tedros. Thank you very much, Dr. Natalia, Payatna, Marianne. Thank you very much for this opportunity of working together for every woman and every child. The COVID-19 pandemic is not only having a direct impact on those infected, but also indirect consequences due to the disruption of routine health services and far-reaching socioeconomic impacts, further exacerbating inequalities. Women are affected differently than men. 70% of health workers are women, and women make up the majority of carers at home, as well as workers in grocery stores or pharmacies, putting them at high risk of infection. Projections from the United Nations Population Fund, just as Dr. Natalia was mentioning, estimate that disruptions in sexual and reproductive health services could limit access to modern contraceptives for 47 million women and leading to 7 million unintended pregnancies. Also, a very important issue is that violence against women has already reached epidemic proportions in all societies, with 137 women killed every day globally by a member of their own family. The level of domestic violence and sexual exploitation further increases as a result of confined living conditions and economic stress. Children and young people are not put at the center of this pandemic, but they risk becoming the greatest victims. They are severely impacted by socioeconomic measures, with 42 to 66 million children who could fall into extreme poverty as a result of the crisis this year. Financial hardship for families and the closure of schools are expected to increase malnutrition, with long-lasting effects on well-being of children and young people. Young people in particular, the most vulnerable, such as the young migrants, young refugees. Young people with HIV also have limited access to information, education, and social support services. To ensure that the pandemic does not disproportionately affect women, children, and adolescents, but also that we take this opportunity to build a better and fairer societies, we need to ensure, first, that measures taken in response to COVID-19 protect and support the most vulnerable. As a parliamentarian and as president of the Interparliamentary Union, I know that parliaments have a great responsibility in this regard, and that they must be at the heart of the national and global response to COVID-19. We need to prioritize the continuity of services, including sexual and reproductive health services, immunization, and nutrition programs, ensuring access for all women, children, and adolescents. Also, we need budgetary oversight so that an effective response can be assured. As WHO has been mentioning, find, test, isolate, treat, and trace. It is also important that decision-making processes are inclusive. This means that we need equal representation of women in order for policies and strategies to be effective for those in greatest need. Ensure that health workers have personal protective equipment. Healthcare workers and first responders must be protected. And of course, they must also be protected against stigmatization and attacks. Address care work, paid and unpaid, that is largely performed by women. Apply a gender lens in the design of all measures to address the socioeconomic impact of COVID-19 to ensure greater equality and social protection of women who are more likely to have lower paid and to have less secure jobs. For this pandemic, we must not lose sight of the needs of pregnant women as a vulnerable group. We must care for them and for their babies. The IPU parliamentarians are committed to the implementation of the Universal Health Coverage Initiative. This initiative represents an opportunity to promote a comprehensive and coherent approach to health through health system strengthening. This initiative has its basis on the belief that all persons and all communities should have access to quality essential health services. Governments must ensure the safety and well-being of children. We have here a lot of numbers, but the reality is that we took children as a population that is already safe. And that is not 100% sure answer. We need to come with answers in terms of nutrition, in terms of health, in terms of schooling. It is also about their well-being. And as parliamentarians, our duty is to ensure that these problems are adequately addressed in legislation, as well as provide the means to do so through approval of budgets that can fund efforts into that direction. We need to ensure a comprehensive approach that goes beyond the immediate short-term response to the pandemic. Yes, it is very much needed. We need an answer and a solution for the pandemic, but also we need a plan. We need measures to address the root causes of gender and social inequalities that must be at the center of efforts by parliaments, governments, and all other actors during and after COVID-19. This includes addressing financial, cultural, and legal barriers to access health, improving nutrition and access to education and information, including on sexual and reproductive health and rights. The time for action is now. We have a collective responsibility to protect and promote the health and rights of all women, children, and adolescents. In the face of this pandemic, we cannot continue business as usual, and we must take this opportunity to finally drive the changes needed to transform our societies for women, children, and adolescents. From the Interparliamentary Union, we're fully committed on having parliamentary responses to COVID-19 and to build better societies after this pandemic. Thank you very much for having us and working directly with the parliaments.
Muchas gracias.
Thank you very much.
If I
Yes,
may,
please, go ahead.
Thank you very much, and thank you, Natalia, for bringing parliaments and parliamentarians to this conversation. Indeed, we have a very important role here when it comes to budget allocation. And I would like to separate two issues. I think, and as a parliamentarian, not only as president of the IPU, but as a parliamentarian, I think that we need to see if the budget that was designed for 2020 is still working for parliaments. Honestly, I don't think so, because most budgets were designed in 2019, where no one was imagining what's going to happen in the world. I think we are not even imagining what's going to happen in 2 months. So I think that we need to take a look to budgets that are being applied for 2020 and to allocate more budget for these health systems and the huge demand that they are facing. We have seen some examples of countries that are building hospitals in a very fast way, that are developing research, studies, tests, and it is clear that budget is not being enough for the huge demand that the population is needing. And not only related to the basic health services, but for example, we just mentioned violence against women. We need to strengthen all systems that are going to help women during this pandemic. Women are being left behind. They are not protected at home, they are not protected at work, and they are 70% of the health workers. So we need to put women, adolescents, and children at the center, because, allow me to speak as a politician, but not a medical doctor. We have been hearing news talking about how this virus affects more men than women, and how children and adolescents are not contagious. So we need to take a look on the different ways that this pandemic is affecting each of the groups, and women, children, and adolescents cannot be left behind. And the other issue is, what are we going to do with the next budgets? Because this pandemic is going to have severe effects, not only now, but also, I think it was Marianne who was saying, we need to take decisions right now, but for also taking a future consideration. So I think that it goes also to budget. Which are the needs now and which are going to be the needs in 2021? Because it is clear, and I think almost all countries are going to face that reality. I think that was part of what Natalia was saying. The economy is also struggling. And when that happens, also public budget is going to be affected. So I think that we should take a look at which are the priorities for the humanity. What are we going to do, especially with children and adolescents? They do not vote, they do not participate in politics, but that doesn't mean that they cannot be taken into account. So I think that we need to put women, children, and adolescents also for our priorities in budget for 2021.
Many thanks, Dr.